light of love is shining in my eyes. I am happy, healthy, wealthy, and wise. Yes, I am. I am happy, healthy, wealthy, and wise. Happy, healthy, wealthy, and wise. And I know the light of love is shining in my eyes. I am happy, healthy, wealthy, and wise. A little birdie told me that life is so sweet. As I listen to her song, I know I am complete. I have all the keys to love, joy, and peace. The power is infinite. Love will increase.
All right, Lagos, Nigeria, good morning to you from whatever part of the world you might be listening to me from. This is me telling you to always say to yourself as you perhaps wake up, even as you're at work, whatever the day, whatever the time, you're happy, you're healthy, and you're wise. There's some positive affirmations that you continue to say to yourselves on a daily basis that does a lot of good. You'll be surprised, you'll be shocked as to the number of good, it can do for you and your well-being. Saying things until it eventually becomes your reality. Say them like you mean them. Once again, welcome to Talk to a Doctor on Nigeria's One Health radio station, Wash 94.9 FM. I am your host, and I'm Anthony Daumelda. Welcome to Nigeria's Fun Health Radio. And as always, this is Talk to a Doctor. Today is the 18th day of the month of July 2025, if I'm not mistaken. And thank God it's Friday. The weekend is upon us. And it's another day where we get to look into health topical conversations. And today we're going to be looking into fibroid. And if you're wondering, okay, why are we doing fibroid today? The month of July generally is a fibroid awareness month. So we're dedicated and we're trying to create an awareness, to fibroid. And if you're talking about what this day is all about, or the month that is, it is recognized every July simply to raise awareness about uterine fibroids, talking about their symptoms, their treatments, and their impact on women's lives. And the goal is to break the silence around fibroids, encourage early diagnosis, and improve access to care. So all of these are what I hope that we will unravel on the conversation this morning. So if you're trying to understand what fibroid is, trying to, be certain that this is what it is and not necessarily the side talks, the guess talks that we continue to hear about, subjects as such, this is where you have to be. So we're going to help you understand what fibroids are, how they impact women's health, why education on this conversation is important, and look at perhaps treatment options. Talk about how to manage it. Try to understand the many complications, of fibroid. As always, we get to bring to you, the best, and doctors who would continue to provide valuable insight. Ensure that the conversation we have, continues to provide a lot of understanding, in-depth understanding, analysis as to the conversation. And doing this with us today is a highly experienced general practitioner. Yes, with a rich background in women's health, diabetes care, minor surgery. I could go on and on. After obtaining her medical degree from the College of Medicine, University of Lagos, sometime in 1988, she embarked on a journey to England, where she practiced as an obstetrician initially and gynecologist in top hospitals in London, including Guy's and St. Thomas NHS Foundation Trust. And she also holds a diploma in sexual health and reproductive medicine. She also became a member of the Royal College of Obstetricians and Gynecologists in 1998. All right, it's a honor having you yet again with us this morning, Dr. Folakemi Edun. Good morning to you.
Good morning to you, Anthony, and to everyone out there. It's nice to be here, the month of July, the month of Fibroid awareness. Thank you so much for having me.
It's always a delight. I think it's been over 2 months since we last had you here with us, to grace your insights on health topical conversations. And as always, I want to appreciate you for always making availing yourself, availing your knowledge as to the conversation we bring to you. And that being said, Lagos, Nigeria, as always, you can be a part of the conversation via WhatsApp for the time being. You have questions, pertaining to the subject matter, we can relay those questions to the number 0915-849-4949. 0915-849-4949. Subsequently, I'll put up on the phone line so we can as well, get your thoughts verbally. And at the moment, I think we get into that conversation proper, trying to understand, the nitty-gritty, what fibroid entails. So, Dr. Folakemi, for people that are not necessarily familiar, we know that we hear the term, we keep hearing fibroid, but a number of us cannot, put a pin on what exactly it is or what causes it. But for a start, let's understand what exactly this is.
Fibroids, that's a word that always terrifies a lot of women when they hear that, and men when the women hear they've got it. I'm hoping by the end of this talk I would be able to reassure people and sort of give them more knowledge, and I believe that knowledge does help. So what are fibroids? Fibroids are benign tumors in the womb. What did I mean by that? They are not cancerous. They're not cancer. They're little tumors that form from the muscle of the womb, and they can be just in the muscle itself of the womb, or they can be on the outside of the womb, indenting outside, or they can actually indent into the cavity of the womb. They're not cancerous. They're very common. Most women will have them. Most black women, about 8 in 10 black women will have fibroids. That doesn't mean they cause problems. That's how common they are, especially in the reproductive age. They're very common, and more common about the ages of 30 to 40. But like I said, they're not cancerous.
They are not cancerous. And you mentioned something, and I want to highlight that. You said about 8 to 10, and you were very specific with black women. You said black women. Does this mean that it's not common in perhaps Western climes?
It is common as well, about 6 to 10, but more common in the black. But the problem with fibroids is we all have them. It's like having little moles. They only cause problems depending on the size of the fibroids, depending on where they are in the womb itself. That's when they could cause problems, because you could happily be going along with them and not even know you have them until maybe you have some investigations for something else, or when you have symptoms of fibroids, then you know they are there. So they're quite common. They can range from just 1 millimeter to 20 centimeters. So that's how common they are.
So talking about how common this is, and you mentioned about 8 in 10 black women tend to have this. And when do you think, or when does it become a cause for concern or a cause for worry, if it's something that is somewhat, I don't know if I would say natural, but for the lack of a better word for now, I'll say, is it perhaps something that is natural with women? And if that happens to be the case, when does that become a cause for concern?
It becomes a cause for concern when you start having symptoms. So symptoms that you can have are heavy periods, heavy prolonged periods. You can also have a feeling of pain, pelvic pain, so pain down there. That could be because of the size of the uterus, of the fibroid, which has distended the uterus. So if they're quite large, they can compress on nerves in the pelvis. They can compress on your bladder, so you might start peeing all the time. You can have this feeling of heaviness down there, a feeling of pressure down there if they're quite big. If they're also, like I said, depending on where they are, if they're indenting into your cavity, they can also increase your periods, making them heavy. So why do they do that? Because if they indent in the cavity, the surface area of the cavity increases. So where you bleed from increases. So your bleeding will be heavier and will be more prolonged. And also the ones that actually it could also cause subfertility, problems getting pregnant. Not all of them cause that, but a few will. And the ones that do that are those that indent in the cavity and those who are quite big. So they might be in the lining of the womb, sort of in the wall of the womb, but they're not indenting into the cavity. But if they're bigger than 6 centimeters, they might cause problems in fertility. They could also cause miscarriages. The more common ones that do that are those that indent in the cavity. They could also cause premature delivery. And also you could end up, if you're pregnant, you might even end up having a cesarean section. The reason being that it could be where the fibroid is positioned, whereby it's safer for you to have a cesarean section, whereby it could be that it's in the cervix itself, that's the neck of the womb, or it could be blocking the baby from engaging to come down, or maybe you've had an operation for fibroids in the past, so you would need to have a cesarean section. So like I said, it really depends, on the size of the fibroids, it depends on where they are for them to cause symptoms, or you might not even know that you've got them in the first place.
You mentioned two things I want to, take out. You mentioned that to an extent it can affect fertility, but it depends on perhaps the kind of the position. Does it mean we have different kinds of fibroids?
We do. So we have different kinds of fibroids. So we start from the outside of the womb. So the lining of the outside of the womb, you have what we call subserosal. So they're on the outside of the womb. Most of the time they cause no problems, except they're huge. So if they're quite big, then you could have the pressure symptoms. You could have the fact that you could have pain. Sometimes they outstrip their blood supply when you're pregnant and give you pain from that. But they tend not to cause problems with fertility or give you a heavy period. They could give you the feeling of heaviness when they're huge or pelvic pain. So that's that. You have the one in the muscle itself, which we call intramural fibroids. The intramural fibroids can sit there happily and cause no problems at all. Of course, if they're huge, the symptoms of the heaviness is there again. The feeling of pelvic pain, even pain while having sex, because if it's that big, it can cause you pain. It can cause problems with fertility when they're bigger than 6 centimeters. That's when they could cause problems. But the ones that usually cause the problems, which we all talk about the most, and that's the heavy periods, problems with fertility, the prolonged periods, the pain, is the subserosal fibroids. What do I mean? They're the ones that actually are just at the edge of inner cavity of the uterus, and they indent into the cavity. So they then can cause problems. They can give you a heavier period. They can stop you from getting pregnant. Good. Because not all of them. Sometimes you find women who are pregnant and they go for a scan. That's when they find that they have fibroids. It hasn't stopped them from getting pregnant in the first place. But the subserosal ones could do that. I'm using the word could with everything I say, because having a fibroid is not, it doesn't mean that's the reason for your subfertility, your problem as to why you're not getting pregnant. We need to remember that to get pregnant, we need an egg, we need a sperm, we need it to meet, even before the implantation into the womb. So are you ovulating? Is your partner's sperm count adequate? And I hope there are no blockage in your tube so that they can meet, because they need to meet. The egg from the ovary needs to meet in the tube to fertilize with the sperm for it to move into the cavity for it to then implant. So we have all the things that needs to be looked at first before we blame the fibroid. The fibroid might not be the reason. Sorry, I digress a bit.
No, that's absolutely fine. That's absolutely fine, Dr. Folakemi. So
we also have fibroids. Sorry, one more. You said types of fibroids.
Yes,
we still have fibroids in the cervix, We can have it in the cervix. And the one in the cervix could sit there happily, cause no problem, until you are pregnant and you want to have a baby. You want to deliver. So it might stop the cervix from opening up, and in such cases, you will need a cesarean section to deliver that baby. Thank you.
So, in a manner of speaking, you're making us to understand that having fibroid doesn't necessarily prevent you from getting pregnant.
Yes.
Amazing.
Depends on the size, depends on where it is. I know that a lot of people get fixated on their fibroids. I need to remove it.
Mm-hmm.
No, not all the time. It depends on the size. It depends on where they are
now,
in the womb.
You've been mentioning size of the fibroid. Obviously, I'm not sure there's any way any woman can tell with the physical eye the size of a particular fibroid. So how do they go about this? And before that, it's also, you mentioned that some of the signs, perhaps the heavy period and the pain, the heavy flow, does it mean for every woman listening now who might be undergoing some sort of heavy menstrual flow with a lot of pain, does it always suggest that it is a form of fibroid?
Not necessarily. There are other causes of heavy periods as well.
Okay.
So the fibroid being the most, the most common reason is no reason at all. So you have an ultrasound scan, they do everything, they can't find the reason why your periods are heavy. But for Black women, fibroids also cause heavy periods. The submucosal fibroids, not the intramural ones, not the subserosal ones, not the cervical one, the submucosal ones. That's the one that indents into the cavity.
Okay. And
why does that do that? When you think about it, when you think of a ball, right? And it's nice and round. And all of a sudden, you increase the surface area by putting a smaller ball in the middle. So there will be more surface areas for it to bleed from. So that's why you have heavier periods when you have a submucosal fibroid.
Okay, to mention
so that could be it.
All right.
Sorry.
All right. To mention in passing, does fibroid make women's belly inflated? Just to mention in passing.
Not inflated, but could make it bigger because the fibroid is in the womb and the womb can be big. A lot of women, as they get older, especially those who have fibroids, because the fibroid can be stimulated by the female hormones, which is the estrogen and progesterone hormones. If you have fibroids, they tend to grow as you get older. But when you go through menopause, when your estrogen and your progesterone drops off, they start shrinking back. So yes, you see, especially in us Blacks or Nigerians and Africans, we especially grow big fibroids compared to other races. We grow them big, and they can be quite big, and you can notice them when people are walking around where, yes, the fibroid could be the reason. But sometimes it's not the reason. It could actually be because the person has a lot of fat around the waist or other things as well.
Okay, now since you've given us some hints and you've given us signs, I think I'd want to also get our women to be more educated, because many women suffer with fibroids for years, even before being properly diagnosed. I think in most cases, I think our women must have gotten to that, break point where things are now quite severe and dire and they have to start running for emergencies here and there. So what are those signs? You've mentioned a few. I don't know if there are more to look out for, just so that our women can be forewarned before we now move into diagnosis and how they can, come out. They can confirm that, there's a fibroid somewhere, in their womb.
Okay. The most common symptoms of fibroids, like I would say again, is no symptoms at all.
No symptoms at all.
You might be happy. You might have no symptoms at all. but then it's one of the causes of heavy bleeding, heavy periods, heavy prolonged periods, heavy painful periods. You can have pelvic pain depending on the size. You can have the feeling of heaviness, pressure. So if it's quite big, it can be leaning on your bladder down there where you're passing urine more often. Okay, you could have problems when you're passing stool as well. You feel that pressure and problems passing stool. It could also cause pain during sex. It could cause miscarriages. It can stop you from getting pregnant, or even miscarriages, or even premature delivery. So, yes, fibroids cause all that, but you could also be happily walking around with nothing at all.
Interesting.
But if you have those symptoms, it's very important you see a gynecologist or someone who has good interest in fibroids or women's health, so that you don't end up having an operation you do not need, because there are other treatments that could we should always tailor treatment of fibroids to that individual woman. So a woman can come to you, she doesn't want to have a baby yet, but she's having heavy periods. The treatment for her will be different from a treatment for a woman who's been having problems getting pregnant, or a woman who is trying for a baby, or a woman who's had recurrent miscarriages because she's got submucosal fibroids. So the treatment should always be tailored to that woman. And it's not always a need for operation. There are different types of operations. And there are different types of operations as well.
Once we get to that, we'll cross that bridge, certainly, Dr. Folakemi. Yeah. But as you've mentioned, no common symptoms at all. Can we see that fibroids can also be genetically predisposed? Or you don't have to worry about it if you have an antecedent who might have suffered from it as a woman?
There is genetic predisposition as well. We found that it runs in families. So mothers, sisters, it could run in families as well. But that doesn't mean because your sister has it, you will have it for definite. So if you notice, I use the word could all the time.
Okay.
So it could run in families. It can run in families. We've seen it run in families. So it's thought to be a genetic predisposition as well. It is also more common in women who are overweight, obese. All right? So if you're overweight, you tend to do that. It's more common in women who start periods early as well. It's more common in women who are not getting who have not had children. So there is a saying that, I don't know if it's politically correct anymore, but there used to be a saying that said, if you don't grow babies, you will grow fibroids. So you find a lot of elderly women or women in their 40s and 50s who've never been pregnant who have huge fibroids. You have nuns who have very huge fibroids because they've never had children as well. So there is that genetic and several risk factors that could cause this as well.
So perhaps once we return, because we have a quick break to go for, once we return, perhaps we should look into some of these, causes, the risk factors, before we get into conversations around the prevention, how to treat it, how to manage it, and the likes. Once again, you're listening to Nigeria's Fun Health radio station, Wash 94.9 FM. We're talking fibroids this morning, and we, of course, have the pleasure of hosting Dr. Folakemi Edun here with us on the broadcast. Once again, the WhatsApp number to send in your questions, 0915-849-4949. Stick around, we'll be back shortly.
The first and only authentic health radio in Nigeria.
Wash 94.9 FM.
All right, welcome back. 15 minutes after 10 this fine Friday morning as we're talking fibroids on Talk to a Doctor. So you have questions with regards to the subject matter here this morning that we're having. Do all to be a guest and put a call through the numbers 0906 099 2609. 0906 099 2609. Alternatively, you can also connect via the number 0704 100 7949. 0704 100 7949. So whatever question it is that you might have in regards to fibroids, Dr. Folakemi will be ready to oblige them. Getting back to our conversation this morning, I said before we went for that break that I was going to ask the causes, if we are able to perhaps fathom or put a name to some of these causes or some of the risk factors that could predispose one, especially a woman, to developing fibroid.
Hi. Welcome back, everyone. So risk factors, most of the risk factors we cannot change or alter. And that's the first one is age. As you get older, the risk of you having fibroids increases. So it's more common in the ages of 30 and 30, between the 30, ladies in their 30s and in their 40s. And as you get older, you get fibroids, they get bigger. And when you go through menopause, they shrink. If you're overweight, that's the only thing that you can modify. So try and prevent yourself from being overweight or obese. Your race, being black, we can't change that. More common in black people, 8 in 10 people who are black will have fibroids. Starting your periods early, you also cannot change that. That's also a risk factor. Never being pregnant. Like I said earlier, there's a saying: if you don't grow babies, you will grow fibroids. So those are the risk factors. Having a mother or sister that's got fibroids could also predispose you to having fibroids as well. So like I said at the beginning, most of the risk factors you can't alter, you can't modify. So you just have to be aware of them. The main one that you can do is making sure that your weight is well controlled, and that you can do through lifestyle changes.
It's almost as though we are being relegated, especially women, to a life of I wouldn't say fibroidness, because having to look at the risk factors you mentioned, talking about age, we're all going to age, our women will age, talking about being a black woman, we're black. So since you've been able to understand or highlight these particular risk factors, how can they be diagnosed? Is it something that you can find on a routine checkup when you're going for your full body checkup and all of that? Or do they require, extra tests?
Yes, they can be diagnosed by a doctor who can examine you. They can examine your tummy. They can examine you from down below. It can be diagnosed for definite by doing an ultrasound scan. So the ultrasound scans are usually done either from the top of your tummy, if they're quite big and they'll be easy to see, or if they're very tiny ones, then they will have to do the ultrasound scan from down below. So those are the main ways of diagnosing it. And then depending on the size or whether they want to go for treatment, you might need to have other investigations. But those are the main investigations that are used to diagnose them. So you can find them on just routine checkup or by having an ultrasound scan.
And that moment, when a woman perhaps has been able to identify, establish that, okay, there is fibroid here. What are the options for her? What do you suggest that she do in order to manage that particular situation? Because just like you mentioned, it's not all fibroids that require an operation. So what are the available treatment options?
Like I said earlier, it really depends on what your symptoms are and what circumstances you are at. So if you're a young lady who is having just heavy, painful periods, and you're not planning to have children at the moment, the medical treatment, so you can have medications like tranexamic acid, mefenamic acid, which will help reduce your bleeding, your periods, so they will not be heavy and they will not be painful. You could also go on the combined pill or the progesterone only pill. That could also reduce your bleeding. You could also use something it's a hormonal coil. So that you need a nurse or a doctor to put inside, and that could help reduce your heavy periods and your painful periods. So, like I said, every treatment needs to be tailored to the individual and their symptoms and what they want to achieve later. For women who are having frequent micturations, or they're passing urine more often, or they're having constipation because the fibroids are quite big, or they're causing pelvic pain because of the size of the fibroid or heaviness, in people like that, they will probably need surgery. So this then depends on the size, how big they are. So the surgery could either be something we call mammectomy, which could be either done laparoscopically, if it's a subserosal fibroid on the outside of the womb. So what do I mean by laparoscopically? It will go through the belly button. It's under general anesthetic, goes through the belly button, and they take it out through the keyhole surgery, or you'd have to have a major surgery to take out the fibroid. We also have, for some cut you at all, but it's done from down below. So they come through the neck of the womb, and it's also general anesthetic as well, and they just take the fibroid out from down there. They shave it off. Like everything in life, there are risks. So the risk of any major surgery, be it an open mammectomy or a hysteroscopic mammectomy, is bleeding, infection, or they might put a hole in your womb. So if it's hysteroscopic mammectomy, there's a risk of putting a hole in the womb. If it's open mammectomy, there is going to be a hole in the womb anyway, which they will suture up. And all those surgery also gives us the risk that you might lose your womb completely.
Exactly.
That fear. But if you've it's a slight risk, which is why going for an operation for fibroid is not something you take lightly. If you've completed your family and you're just having the symptoms of fibroids, and it's actually easier to take the whole womb out. I know a lot of people are probably up in uproar now, thinking, oh my God, my womb is coming out, makes you less of a woman. It doesn't. It's actually an easier operation to take the whole womb out if you've completed your family than doing a mammectomy. Mammectomies are usually quite bloody. The open surgery, they're bloody. And that's why you hear people die when they went to have an operation for fibroid.
Exactly.
And the reason being that the doctor is trying to save the womb and not save the woman. Because the woman feels, if I don't have a womb and I'm a less of a woman, you're not. So when you go for that operation, a lot of doctors ought to be saying to their patient that actually, because it's a bloody operation, if you start bleeding, to save your life, I might have to take your womb out. And people need to appreciate that could happen. And it doesn't make you less of a woman, but you'll be alive and you'll be well afterwards. And if you've never had children, and this unfortunately happens to you, there are other ways of having children. We've got surrogacy. We've got adoption as well. And we need to remove those taboos as a culture and as a society. And let women be able to be alive and well.
Dr. Folakemi, these are very hard truths, bitter truths that you're actually sharing, and I can imagine how, a person, perhaps a sufferer from a fibroid, might be feeling, listening to these at this moment. But just like you mentioned, especially in the case of persons being fearful, the thought of going for an operation during a fibroid can be one of the most scary, things yet. And I'm speaking from experience because I have a friend who's quite close to me, who had to undergo an operation some years back, for fibroid. And she's not been able to conceive yet, but I was going to come to that later. But before that, so for those fearful of going for operation, in treating the surgery, you see a lot of persons might want to tilt towards alternative medicine, or better put, some natural remedies because there are reports, or perhaps I've heard, but I don't know how true this is. Perhaps you can help us, provide some answers. Are there any medications or natural remedies that can shrink fibroids, or perhaps manage those symptoms better?
There are medications that can shrink fibroids, but I will bust your bubble that there are no research for the natural ones. So what do I mean by that? Medically, there is something called a group of medications which we call GnRH analogs, which can help you shrink the fibroids. So they're injections which you can have every 3 months. And the way they work is they make you go almost into a menopausal state. I said that when you go through menopause, your fibroids start shrinking. So what they do is actually they can shrink the fibroids, the injections. So the GnRH, which your gynecologist can give you. There is also something called uterine artery embolization. So they sort of block, the radiologist blocks the blood supply to the fibroids, and that can stop it. But you will go onto the internet, you talk to a lot of women, they talk about all these herbal remedies that shrink fibroids. All the research out there do not confirm this. A lot of people are making money on the back of women's fear by saying they have remedies to shrink, natural remedies to shrink fibroids. If those remedies include you not being overweight, removing stress, of course they will help you control. What do I mean? It won't shrink your fibroids, but hopefully not make it grow much more or even help. Because we know one of the risk factors of you having fibroids is being overweight. So if you're not overweight or you're losing weight and you're keeping your weight down, then fine. But all these natural remedies, I'm sorry, research has not proven any of them beyond any doubt that they work. But people pray. A lot of companies out there prey on women's fear by saying this, because women are very fearful of other alternatives to treatment of their fibroids. So like I said initially, your treatment should be geared to your symptoms. It might not even be surgery. And if it's surgery, it might be just a hysteroscopic mammectomy, which is a keyhole from down below. Or it might be open, or it might be hysterectomy. But what I would implore everyone is make sure you see a gynecologist, not just a doctor, not just a surgeon, but a gynecologist who is specialized in dealing with fibroids if you have the problem or if you need to have surgery.
All right, thank you for also highlighting that. And let's talk about some myth. Let's talk about certain notions that persons, tend to relate fibroid with. Some would say perhaps once it's been established that you're having fibroid, it means that you're barren. Or some would say that once you're having fibroid, I know you've already made us understand that the conversation around pregnancy doesn't necessarily relate to fibroid alone. So because some would say you can never become pregnant. So I just want you to make us understand what exactly is true and what exactly is misleading. You already said that fibroid aren't cancerous. So is it something that also can be reversed? so once maybe one might have had to go through oppression, maybe you've gone through various treatments, is it something that can be reversed and you become without fibroid, or you have to manage it till, permanently?
If you've had an operation for fibroids, you can grow more. And that's why I always say to people that if you've got fibroids, huge fibroids, and you're not ready to have children yet, don't go having the surgery yet, because you might find yourself, when you're now ready years later, that you now have fibroids that might cause you to have problems getting pregnant. So you might have to go through surgery again. So don't do the surgery until you're ready. If that fibroid causes is the cause for your not getting pregnant, because many women with fibroids will get pregnant and will have healthy babies. So having fibroids doesn't equate to not having babies, doesn't always equate to miscarriages or decreasing the chances of pregnancy. But like I said initially, it depends on where they are. It depends on how big. So what I usually say to my patients actually is that try, even if you've got fibroids, where are they? How big? Go try getting pregnant first of all, before you start chasing after the fibroid, because there are other causes of subfertility. It might not even be the fibroid in the first place. Like I said, you need an egg. So are you producing, are you ovulating? Your partner needs to have a sperm that swims fast enough. So what's his sperm count like? What's his semen analysis like? And is your tube open? Before we start blaming fibroids, I need to have the operation. So we know that fibroids could increase the risk of miscarriages. We know that it could decrease your chances of getting pregnant. But we also know that a lot of women with fibroids get pregnant and have healthy babies. But it's important. Speak to a gynecologist who specializes in that. Let them do the investigations and tell you if you're one of those that needs to have surgery to remove them so you can get pregnant.
And in the case, because of our time, we're gradually grinding to a halt. Because of ladies or women who tend to be fearful with regards to bringing up conversations that, such. That's one of the reasons why we're having this conversation, by the way. But how would you address women that are afraid, in telling anyone, maybe their spouses, some perhaps once they've been able to identify that this is what's up, they might be afraid in having to tell their, spouses because of fear of, the unknown and fear of the husband or the man trying to, go elsewhere to search for perhaps the fruit of the womb. How would you address that? How do you think men can be more supportive, especially to women, with fibroid?
I think shows like this is very good, is to educate everybody, not just women, but also our men out there. All right. Also, our children are going to grow up to be men as well. It's very important. Even the parents and the parents-in-law, we need to remove the stigma of having fibroids, because it's almost like saying you've got a mole. It's that common. Women do not choose to have fibroids. We need to support them. We need to understand where they're coming from. And it is not a sentence of heavy periods all the time. It's not a sentence of not being able to get pregnant. It is not. We need to support people. We need to be there for them. We need for them to have an understanding, and women also to have an understanding and to empower themselves with knowledge and know what they can do. Because I know that a lot of men go out there, or families, or the society would think of, if there's a marriage and it's not fruitful yet, it's always the woman's fault. Not necessarily. There are two people that need to make a baby. So it could be anybody, and it could be nobody's fault at all. It might not even be the fibroid that she's got that's causing the problem. It might just be that God says it's not time yet. So we need to support women with fibroid.
Once again, I want to say a big thank you for the insight you shared with us this morning on Talk to a Doctor, Dr. Folakemi. And for the benefit of those just listening for the first time, or perhaps you just tuned in, you've been listening to Dr. Folakemi Edun, a highly experienced general practitioner, with a rich background in women's health, diabetes care, minor surgery. I could go on and on, but because of time, I want to say a big thank you. But before I let you off at this moment, any parting words or whatever it is you'd want to say, before we go?
Parting words. Fibroids are common. They don't necessarily cause symptoms. When they do, make sure you get your investigations from a gynecologist. I'm repeating that, not just any doctor, but a gynecologist. It is not a life sentence to infertility or painful heavy periods. You can get treatment. It's not the only reason of subfertility. Women with fibroids need support. We need to remove the stigma. We need to remove the myth. And also, natural remedies, usually no research. A lot of them are gimmicks and ways of making money. And I hope this helps someone out there. Thank you for listening.
Thank you so much, Dr. Folakemi. Appreciate it once again. And yes, once we've been looking into fibroid, made you understand that this month happens to be, Fibroid Awareness Month, which is a month. It's an awareness month, and also it's an important initiative that seeks to educate the public about fibroids generally. And just as Dr. Folakemi has mentioned, these are benign tumors, and it causes a lot of uncomfortable symptoms. We understood that, you can experience heavy menstrual bleeding, pelvic pain, pressure. And that's why we've been talking about this, because we'll continue to raise awareness, as to conversations pertaining to your health. And this is also very crucial for encouraging women, to seek medical advice, explore treatment options, and also go early, go for these things early, go for diagnosis early. And that's why we have to keep checking our bodies, ensure that we go for our, medical checkups and all of these, so as to forestall emergencies. Thank you once again. And to, of course, our listener, thank you for being a part of the conversation. Next week, we'll kick off yet again with another, insightful conversation as to your health. And until then, keep it here. Coming up by 11 o'clock will be Financial and Economic Wellness with Mr. Olalekan Dabiri. Good morning.
Wash 94.9 FM.